Good evening, I'm Sarah Loudon from Total Health Conferencing, and welcome to another episode of inspirED. Tonight we will be talking about issues in the LGBTQ community and specifically blazing a trail in oncology. I'm joined by two medical oncologists who I will ask each one of them to introduce themselves as we get going. But, you know, inspirED was created to give a platform that covers a wide spectrum and different themes in oncology as well as individuals. So we get a great opportunity to look behind the white coat and directly into who the people are in this really diverse field. And our audience have really responded to this in that, you know, now more than ever, we're craving connection with each other, and this definitely gives a platform to do that. So I'd like to introduce both of our panelists, Dr. Arturo Loaiza-Bonilla from the Cancer Treatment Centers of America and Dr. Kevin Kalinsky from Columbia University. But I'd really like them each to introduce themselves and to let us know a little bit about what they do at Ctca and at Columbia. So Arturo, I'm going to start with you. And for tonight, we're all going to be using first names only as we really consider this a living room conversation and we invite the listeners into our lives.
Absolutely. Thank you, Sarah, for the invite and the opportunity to have this conversation tonight. So as Sarah said, I'm Arturo. I'm a medical oncologist and I work at Cancer Treatment Centers of America since over the last 3.5 years. For that, I was faculty at Penn and other places. But yeah, originally from Colombia, came to the United States following the American dream for research, which was my passion. I was the first doctor in my family. So I always wanted to see what else was going on. And that's why I came to the US now almost 2 decades ago.
Wow.
My role at Ctca is, of course, taking care of my patients with GI malignancies. I'm also the director of research, which is a passion close to my heart, as I mentioned. And I'm also into, data analytics technology. So I also work in a company called Vidence, and I co-founded a company called Massive Bio. So basically, I'm all over the place, but my main goal is to help in the lives of my cancer patients and do what I can do every day. So thank you for having me.
Thank you and welcome, Arturo. Kevin, can you tell us a little bit about yourself and your role at Columbia?
Yes, thank you. So Sarah, thank you for including me tonight. So I'm Kevin Kalinsky. I'm a breast medical oncologist. I've been at Columbia now for over 10 years, and all of my focus clinically and research-wise is in breast cancer. My particular interest is in the development of new therapeutics in patients with breast cancer. So I look forward to tonight's conversation.
Wonderful. Well, thank you both for being here. And, we did a podcast on before, kind of all of the field erupted or the communities erupted. We did a podcast on being a Black woman in oncology. And we had 3 incredible women come on, and one, Arturo, you probably know her. I don't know many people who don't know her. Dr. Edith Mitchell from Jefferson.
Absolutely, know her very well.
Yes, and I see Kevin shaking his head too. This was a person, as I was interviewing her and just kind of getting to know more about her and her life story, this is a person that because of her advocacy has really changed. She shaped, not just changed, she shaped the landscape for African Americans, Black people, regardless of if you're from here in the United States, but in oncology. And when she was talking, it was like there are so many stories like that of people who kind of bring their personal passions into their professional environment. And my first question tonight, Arturo, I'm going to start with you, is how do you incorporate the support of LGBTQ issues and community, and where are you passionate in the workplace with it?
Yeah, so to me, like cancer is one of those that to me, affects everyone. And even though we call it sometimes the great equalizer, I mean, there's a lot of disparities happening. And that is because of fear, sometimes into access to care or lack of certain support, etc. And being involved in the LGBT community for a number of years now, I encounter how important it is to first increase awareness of the specific issues that can affect LGBT patients and their caregivers and loved ones, etc. And how cancer itself adds another layer of complexity to that discussion. So, of course, I treat all my patients with the same deference, but I always try to identify if there's any barriers for not only from the patient side, but also from my team side and others to understand what are the major challenges that they may face, and trying to put the frame on my own and see, okay, if I was put in this situation, what will I want my care team to help me with, and how can I get the best care possible for everyone understanding where I'm coming from, what is my environment, and all from the LGBTQ perspective when it matters. So that's in summary what I'm trying to do.
Yeah.
But yeah.
Yeah. That's such a good segue for the next question. Kevin, we run from the medical education side, ASCO, which is our, I know you guys know, but for our listening audience, our kind of society medical meeting. And this brings together tens of thousands of people every year to kind of one central location so that everyone can learn the latest updates. And this year, I read something that was a little bit shocking to me, and I'm just going to kind of quote from it. So according to an ASCO this year, 2020, which is so hard to believe, this is real today. According to an ASCO 2020 session, medical schools provide training for treatment of LGBTQ patients for an average of 5 hours. How do you feel about that? How do we change that? So the reality is during the person's medical school training, we only give them any type of cultural sensitivity, awareness, training or education for 5 hours, less than half a day. How do you feel about that, and how do you think that impacts the way people in the LGBT community are treated in medical practice?
Yeah, I mean, so I think that, I think back to when I was in training, when I was in medical school 1,000 years ago. And, I think that, I think it's likely that, times have changed, and I think it's likely better, but I think that we really do have a ways to go. And, I can't help but think about, I think that even when we take, for instance, our shelf exams or our medical exams, there are questions that sometimes come up about, men who having sex with men, or or various questions that can be related to somebody who's like clearly a gay person. And then, I think that those questions tend to revolve around, somebody who may have HIV or sexually transmitted diseases. And, I think that it ends up, in some ways, remaining a bit of a stereotype, in that, there's certain catchphrases that should make you think, oh, well, maybe this person's at risk for X. And that's kind of how those questions are on the exam. But I think that, ultimately the LGBTQ community is a really broad community with, with various types of people who are being represented. And I do still think that that happens to just kind of breed this stereotype of gay people and the issues, the health issues that, we could be facing.
Yeah. It's as we kind of think about what's happening in our communities right now and how we're kind of finding these voices of people who are standing up and speaking on behalf of, I was struggling to think about who do I turn to, even for an interview like this, like who do I turn to be educated? That's where we are right now, as just like a global community. How can I see you differently? How can I see you for what connects us versus what divides us? Arturo, I'm going to ask you, in the LGBTQ community, are there voices of people who kind of stand for the community where people on the outside who maybe have a misunderstanding or who want to know more can listen to really get to the root of why we're even concerned that there's only 5 hours of training in medical school for this community? Because maybe some people are thinking like, well, what should there be? Or, you know, what are the issues unique to this community? Are there those voices that, you know, people could look to?
Yeah, well, there's so many voices around these days that it's hard to, you know, recognize the ones that have the right tone and they're really looking forward to educate us from a really, you know, neutral perspective, right? So everyone has their agenda, and I respect that 100%. But I also feel that we need to follow things based on science, based on empathy, and trying to understand that not everyone was educated in the same way or came from the same background. So, you know, I have a master's in medical education background. So I always want to think, how can we make folks that, you know, someone in their, you know, my grandmother, I mean, explain this to her is not as easy. And I don't think she's ill-intended. She's just basically doesn't, which was never happening to her. Like, she was never seeing anything like that before. So it takes an effort to explain to her, and we cannot assume that everyone's going to take it with just one explanation. So I think for, as you're saying, for medical school, 5 hours, I don't think is enough. It needs to be expanded further. There's a few, or not a few, no, a number of voices, depending on what we're trying to do for medical education. So I go back to my time when I was in the Medical Association. So I have a good friend of mine, Jesse Ehrenfeld. He's an anesthesiologist, and he developed a program for, you know, for LGBT health, and he opened it at Vanderbilt University.
Wow.
And the model that he did, he actually expanded in other centers across the United States. My good friend, Bali Yehia, who is an infectious disease doctor, now the chief medical officer of a large conglomerate of hospitals. Before leaving Penn, he opened the LGBT program at Penn for our patients. So I think every single place has an opportunity for education, and having those voices shining, not just simply Hollywood actors, and because, you know, that's a different story, and they have different realities. But we as physicians, we need to focus on those folks that have the you know, the science and the methods behind it, and they're living the LGBTQ community and life themselves in a way that we can understand. So I encourage, probably communicate with them as well, and if there's anything from the Facebook messages and stuff that they want to address, happy to direct them to the right places. But certainly a lot of opportunity for education.
Yeah. You know, it really does start with it starts with a person wanting to be open-minded, wanting to be educated. You know, I just from a personal story before we kind of get back into the interview questions, without getting political at all, when there was kind of the political landscape was that we were looking at all of these candidates running for the Democratic seat. And I have to say to both of you, for reasons completely unassociated with his sexual orientation, I fell in love with Mayor Pete. I thought he was young, he was dynamic, he was a great communicator, like all these wonderful things. For the first time, I felt like I could identify with a candidate. I wasn't looking at this older statesmanly type person. And I wasn't looking at a woman. I wasn't looking at a Hillary or a Klobuchar or someone. It was like, no, I really like this guy. And I remember in a small group, I said something like, I would really love to see Mayor Pete win this. And someone, I mean, I'm 43, someone around my age said, I would never vote for a gay person. And it shook me a little bit, because it was like, if you asked me to describe Pete Buttigieg using 10 words, none of them would be gay. Right. Not one of them would be gay. And when I thought of the person's reaction and thought the only reason she wouldn't vote for him is because he's gay. Like it was almost like every other thing was thrown out the window. And Kevin, again, like thinking back to that interview that I had with these Black powerhouse women, do you encounter things like this? And maybe not even you specifically, but in the community, is this still something that's like, what? I thought this was like the year 2020. This was not even an issue. Like,
Yeah.
are we encountering where people could say, I don't want this doctor to treat me because he or she's gay. I don't want to treat that particular patient because he or she is gay. Or is it different in medicine than it is in the world?
Yeah. And that's such an interesting question. So I have a few thoughts. So one, just to go back to Mayor Pete for a second, and again, not to get political.
Yeah.
But, I think what was interesting about him is that, he, and I think that this exists for most gay people, right? It's just one element of a person, right? There's so many other things that could define him. He's a highly educated vet, that was just one element where he just happens to be gay and is married to a man.
Yeah.
And I think that, what I appreciated about his candidacy was just that, there's some people who really may not know somebody who's gay or be really good friends with somebody who's gay or have a family member who's gay. And I think without knowing that sort of person, things end up getting, I think for some time, gay people were really politicized.
Yeah.
And, once there was the Supreme Court decision with gay marriage, I think that lessened the politicization somewhat, but then kind of moved on to a different sector within the LGBT community where it moved on to people who are transgender, right? And I think that, for some time, we were really boogeymen. And then I think that over time, and over a generation shift, that somewhat changed. But, I think that, so I live in New York City, and, I think that I may live in somewhat of a bubble where it's not something that I think that me and my husband, who's also in medicine, face on a regular basis. But, I also think that the truth is that in some of my interactions with patients, I know probably more information about my patients than they may know about my life and, the fact that I'm married to a man, et cetera. And, that's also the makeup of a patient-physician relationship, right? Where it's very patient-centered, and that's how it should be. It should be about the patients and their lives and things like that. But I do think that there may, and Arturo, I wonder if you have the same sort of experience where there's some patients that, I would probably be more willing to like fully share my information than with others, because I also don't want to compromise that patient-physician relationship, because that's a really important relation where you feel it's important that the patient feels like they trust you wholeheartedly, and you don't want anything to kind of impact that.
Yeah, Arturo, so yeah, can you answer?
Yeah, so I mean, that is once again, I echo the sentiment of this being a very interesting question and something that I think all of us have encountered at some point. I had some patients who have very strong beliefs and thoughts about that, and they become, as your friend, becomes a single issue, right? So I could be the most amazing doctor in the world who actually cured your cancer. And if that happens to be known, then I'm like, oh, maybe I don't want to be your doctor, your patient anymore.
Yeah.
I have a interesting story. Just to I mean, it's kind of, it's a little bit sad, but it has a good kick. So a few years ago, when I was at Penn, right before the elections, once again, not political, but the Pulse massacre happened. And it was a pretty bad situation. And the day after, I had a patient coming to see me with his wife. They really loved me. Like, they gave me like this beautiful piece of like crystal that cost like $100, like a collection antique, whatever. And they really always thought wonders of me and everything. And Before they left, the wife just talked to me and said, "Doctor, you're very smart. Tell me, do you think that these guys who died in Pulse, do you think they're going to hell?"
Oh,
And I'm like, "What?" I'm like, "Well, why is that?" "Well, I'm glad that they're gone because, it's less sodomites in this world." And I was absolutely, I'm like, wow, I don't even know how to answer this. And I had to say, well, you may not know this, but all these people you're describing in different ways, they're actually someone's, sons, someone's,
yes.
daughters, husbands, and you should treat them with humanity. You should be kind. I mean, you have been given the gift of life for your husband to be healthy now, and the very same people who are taking care of him may happen to be gay, and you don't know.
Wow.
She said, well, I mean, because you told me that, I feel a little bit less against these guys, but it's still not convinced. And then she left. And it just was an eye opener, right?
Yeah.
This lady who thought so highly of me, just for one single thing that could have been different in my life or in someone else's, that they're taking care of her husband, and she had made that judgment call. So it's just something that really brings to fruition and to understanding that we should educate everyone, and we should be open, transparent, and advocates to show them, this very important person that actually helped you in your cancer care happens to be also the loving husband of someone else, and you need to understand that. So,
I love that story because it tells of so much. It really tells of, and I don't mean to say this in a bad way, but it tells of like the ignorance, meaning the lack of understanding, the lack of education, the lack of real empathy. And you think that only a few twists and turns of fate, that lady might be mother to a gay man. That lady might, like you said, her husband may have been cured by a gay man. And because she's not aware, she hasn't made herself aware, she's not aware, she's categorized, just like my friend, categorized and thrown away all the other incredible things about someone because of a feeling, an uneducated feeling. And again, being gay, being trans is different from being Black, being Hispanic. It's not something you necessarily see. So it's like here you're living out loud, you're living open, you're living in love, you're living as dads to children, you're living as like all of these things, or moms to children. And yet people still have, like Kevin said, this like boogeyman mentality that says, well, because you're different, because you're other, you're not like me, and therefore I don't want to accept you or to embrace you or even to try to understand who you are, like what makes you who you are. And Arturo, you mentioned the Pulse nightclub shooting. Kevin, my next question goes to this, and I mean, this to me is why we're still living in this environment where these behaviors and thoughts kind of continue. So the question is, on the anniversary of the Pulse nightclub shooting, which I hope wasn't intended, but a regulation was passed that erased protections for transgender patients against discrimination by doctors, hospital, and health insurance company. The deputy director of the National Center for Transgender Equality said, this rule opens a door for a medical provider to turn someone away for a COVID-19 test just because they happen to be transgender. What has to happen in this country for things like this to disappear, for us not to be able to reverse protections around people? What do you think has to happen, and how can the everyday listener of a podcast like this stand up and say this isn't okay?
Right. I mean, I think that it is all about awareness, and and I'm just speaking from my heart and like fully throwing this out there. For me, understanding the people who are transgendered, I have a much better understanding because I know somebody who's transgender, right?
Yeah.
So and you know, have tremendous respect for that person. And, you know, I think that, you know, I think that the amount of transgendered people, you know, right now, I mean, it's a small population, and it just goes back to knowing somebody, whether they are or not. And I think we've made some movement. I think that, you know, even the way that people identify, it's not necessarily binary, right? Like they may say their preferred nouns, etc. I think that, you know, it's a reflection of kind of where things are going. But I think people just can be scared, right? They're scared of what they don't know. And that's a normal reaction. And, you know, I want to just mention one other thing that you totally touched upon, Sarah, and I was thinking about when, Arturo, when you were speaking as well. You know, when, and I'm sure you experience this in your clinic as well, you know, when patients say, well, tell me a little bit about your wife, or, you know, what does your wife do? You know, it's being gay is not something that you necessarily know. It's not something that you necessarily have it as an external appearance that can identify that. And, you know, in some ways, one who is gay, you know, I often react with that. Well, in fact, I'm not married to a woman, I'm married to a man, but it's almost like you spend your entire life coming out of the closet, right?
Yeah.
With various people along the way in various sorts of interactions. And that happens quite commonly in medicine as well. And Arturo, I don't know if you have a similar experience.
Yeah, like, well, before I got married, I have, you know, always like trying, okay, so I know this very cute lady who,
Yeah.
Mm-hmm.
The
Yeah.
setup.
Yeah. Yes.
And then I'm like, okay, I'm married now. And there's, oh, tell me about, like, your wife should be so beautiful. And I'm like, well, the beer could be difficult, but so it's once again, I think, as Kevin was saying, is I think for all of us is like, you know, you have to explain yourself a lot. So what I do end up is like, let's just focus on you, and so I don't have to like go into like non-protected conversations about what I do or not in my after I go home. So so I always try to spin it that way, so at least people, I don't have to like explain anything to them. It's just sometimes it's exhausting. Sometimes it's refreshing, but many times it just ends up being what Kevin is describing. So I always try to just like, okay, let's focus about you and do what's best for your care right now and take it from there. So yeah.
And Arturo, to kind of finish that thought, is it dependent on the relationship or what you know about the patient sitting in front of you that makes you answer different ways? I mean, does that play into it, or is it just like a level of, I just don't want to get into this right now?
Well, it's, I think it's a matter of the, you know, you have to read the tea leaves or read the room and kind of know where they're coming from and where they're asking, right? Because sometimes they even ask for whatever reason, I don't know. Yeah. So sometimes it's refreshing to tell them is, oh yeah, like if they have a, you know, a baby or something like that, oh, you have a daughter, and I show them pictures of Natalia and all that stuff. And then we make it all about the kids. That's a way for me to do it, but it depends a lot on the context and who's talking and why they're doing it. There's a lot of folks who are really well-intended and they really want to give you like the world because they're so thankful, but some others just like, they just want to know about you. And I'm sometimes, those are the same ones that go to like your social media or try to look in like Facebook or direct messages on Twitter and all that. So it's part of that. The relationship is great, but also need to keep some boundaries for a good relationship.
You know, Kevin, when you said, you said, you find yourself spending your life coming out of the closet, it's like, it almost makes me catch my breath a little bit, because obviously I can't identify with that in terms of anything in my life that I would say. I almost have to not necessarily keep secret, but it's not this open assumption that people have. But at the same time, it makes me feel sad that there does have to be kind of almost a commentary, that it isn't just as simple as, you know, if someone says, what does your wife do? And you say, actually, my husband is, you know, a healthcare provider. And that's it. It's like the conversation's over, because it almost always feels like you have to say it, and then there's a comma, and you've got to say something else to kind of change the feel of the room, which does feel very much like, you know, when do you get to stop being different or other, or explaining something, some aspect of your life. So I really, even something as simple as that, you know, you saying, it opens my eyes to think, wow, I never even considered that that is part of a conversation that you guys both probably get all the time. I know, being Spanish, Arturo, I know you get the question of how, you know, with this beautiful wife of yours.
It's like Vergara, yeah, just married her.
Yeah, you just pull out a picture every time. You're like, yeah, I consider them beautiful.
Yes, I can tell you it's the same being Jewish, right? Like how many people,
Yes.
you're a Jewish doctor, I have this daughter, the same, it's the same mentality.
Yes, actually, I totally went over that. Absolutely. So Kevin, you know, we were talking about this kind of reversal of these rights for transgender patients, but, you know, overall, how do we, as a community, a healthcare community, empower people to kind of be stronger advocates for their care as they navigate in, you know, sharing some of these very private life situations once diagnosed as a patient?
Yeah, I mean, from a research perspective, you know, I am an associate editor for this journal, and I am in charge of the reviews of a paper which is reviewing breast cancer in patients who have transitioned. And, you know, it was amazing to me when I was looking for reviewers, like how few people have actually done research in this. And there were just a select group of people that I reached out to review that. So, you know, I think there's that element. And then I think that, you know, just kind of big picture, it's as a society, and it really does, you know, my experience as a gay Caucasian man is, you know, who came from a middle class, you know, upper middle class background is entirely different than somebody who's, you know, African American and transgender, right? Like it's all of our life experiences are unique and different. And it does break my heart, because that's how I really felt was, oh, well, now gay marriage is legal. And then now we've moved to this other sector where what people who are transgendered, who, by the way, in my opinion, is such a brave thing to do that, to identify who you are and to transition, you know, I think that they need allies, right? Yeah. They need allies, people who are not transitioning, who, you know, say that, you know, this is biology and this is who they are, and, you know, acceptance. Like that's the only way I think that as a society we will move forward with this.
Mm-hmm. That's a big ask. Yes. You know, it's a big ask, because I think it first assumes, and it goes back to like what we're experiencing, you know, my son is biracial, his father is Black, and then I'm half Indian and half Irish. So he's just like a melting pot. But even though he's grown up with this side of the family and doesn't identify himself as like Black, from visually, he's a young Black man. Mm-hmm. And he's just turned 17. And, you know, when all of this stuff started happening with, you know, I shouldn't say when all of this stuff started happening, when all of this kind of came to light and more people were just like, enough is enough. It was like the perfect storm of people being home and, you know, not wanting to stand for injustices anymore. You know, people started kind of like coming out and expressing their own experiences with prejudice over the course of their life. And I mean, these were stories where you would just be like, no, that's impossible. You know, like I knew you, or I worked with you, or I worked with the person you're talking about. It's impossible for this to have occurred. But the reality is that even in another area where you're just like, no, this is so old, like this, we don't need this anymore. It comes to light that, Yeah, we do. We do, because so many of us who have been living it have just accepted it as normal. We're not railing up against it because it is part of our normal everyday life. But now that we have a chance and a platform to say something, it's up to the other side to say, how can we change? And Kevin, like you're talking about, in order to kind of move the trans conversation to another place, it means that the other side has to say, I want to know more. I want to understand you. I want to have a candid conversation with you. Even if the conversation is in disagreement, I want to have a conversation with you. And based on what I've seen with, how our country has responded to the racial inequalities, that's a big ask. I don't know if you agree with me, but that's a big ask.
I do. I mean, I think that there's so many factors that have led to where we are with the racial discussion right now. And what worries me with, especially transgendered individuals of color, is that there are so many disadvantages and it's so under the radar. And who's there to really have their back, and who's really there to throw up the conversation?
Right.
And I agree with it's a big ask. But then I think on the flip side, well, in Virginia, there's a transgendered state representative, right? Yeah. When I was a teenager, did I ever think something like that would be the case? I'm not sure that I did, right? So things change incrementally over time. And sometimes it's hard to be aware of it as you're witnessing, as you're going through it. But I do think there's a ways to go, but that train has moved somewhat.
Yeah. And Arturo, I think once we open the door for things like this, once we kind of get the conversations going, and little conversations everywhere going, it's hard to put all of that back in a box. And I do think that that's one thing that this country does do well. It rallies around issues, and it rallies around standing up for or sticking up for people that maybe don't have a voice. So I feel like if there was an opportunity, I mean, I got to tell you guys, as I was recording this quote for the question on the Pulse nightclub shooting anniversary regulation, when I read the Deputy Director of the National Center for Transgender Equality, I didn't even know that there was a National Center for Transgender Equality. I just didn't even know it. And I feel really embarrassed that I wouldn't know that, especially since I sit in a seat where, I'm influencing medical education podiums all around the country, and yet I wouldn't know of an organization or a division that helps support something that's so needed in medicine. So Arturo, I guess my question to you is, since we're talking about LGBTQ issues and people in oncology, is this something that has to be more spoken about from podium? And does that open new conversations to kind of get people closer to the information so that they identify better?
Yeah, absolutely. Well, I think we just have to find the right balance of when folks are listening to it, they don't feel that we're just overwhelming things with an agenda, right? Because that's what happens typically when you start bringing something very frequently, or it becomes the topic du jour. You don't want that. You want to get people to get that knowledge slowly and steady, maybe giving a few key home points for, disease types, for example, like breast cancer. So, remember that transgender populations may be, because of the biological gender at birth, they can be at risk for certain things, and they need genetic counseling, for example. Yeah. Or in a case, for example, I remember when I was in training, testicular cancer. So I had a patient, a transgender patient of mine, who was still in transition, and she wouldn't come to see the doctor because she was just afraid of people realizing that she had a different size of her testicle was getting larger and larger. And she basically saw me when she was so afraid of, being unable to wear like underwear. That's when she saw me. So it's like just that being afraid of only coming to see the doctor because they were afraid of being judged or being treated differently. It was really impactful to me. And I actually have a transgender cousin in Florida, and it was really important to me because even though I'm a medical doctor and a member of the LGBTQ community, sometimes if you don't know the reality of someone who's going through that on a daily basis, you cannot really understand the full grasp of it.
Yeah.
And that's what we had to make sure that people, know who is your transgender neighbor you never knew, right?
Yeah. Yeah. No, that's so true, because you don't know what you don't know. And you might have, just like your patient, you might be living with and around someone who you don't even know is walking a different walk. So it really, I think, is important. And at the same time, it's sad because you would hope that we would live at a time where you could live out loud and you would know as a neighbor that this person has, like Kevin said, has had the courage to kind of step into having the outside match the inside of how they have felt their whole life. So it really, we do have a long way to go. I do, I'm kind of cautiously optimistic that we will find the right balance with champions who move forward, especially transgender issues, as we have found champions that have moved forward gay rights over the years. And so that definitely is something that I'm hopeful for, but in the climate that we live in, I also think that it's a big ask, but it starts with people like us having conversations like this, where we're kind of letting the world know that this is something that, we have to kind of rally around. Kevin, what are some common misconceptions about individuals living in and as lesbians, gays, bisexuals, and trans?
Yeah, I mean, to me, it's maybe not just recognizing the heterogeneity of the population, right? So, both Arturo and I are men who are married to other men, right? I have friends who, are single and wish to be forever. And, I think that, I think it's human nature to assign a label to a person once you know that they fit into a certain category. But then it's a broad group. My experience is different than, a African-American lesbian, right? Like we just have different life experiences. And I think that to assign one label to everybody who identifies in the LGBT community is a limited way to ultimately do it.
Yeah. It's kind of likened to, we have this joke in the Indian community that, someone will say, if your name is, let's say, Patel, someone will say, oh yeah, I know, an Ashish Patel. Do you know him? And it's like, there's a billion Indians, I have friends that say, like, we don't all know each other. And it's a little bit the same because, you're saying, like, because I'm gay, and this person's gay, that we must have these things that we're the same with, but, we're human beings. Just like if I'm married and a girlfriend is married, there are so many things that are not the same about us. But so I do appreciate that, we should be broadening our outlook on what exactly we think of when we think of the LGBTQ community. Arturo, on that, as we're doing this podcast, and I always worry with the podcast, I kind of, I want to say invented, that's the wrong word. I started these at the beginning of the COVID-19, and actually what's funny, on on a recent podcast, someone was saying that they started to teach yoga, like Zoom yoga, because that was like their healing process. And I feel like I started this podcast kind of as my own healing process because I started it amidst feeling very isolated and feeling like my normal modes of communication have been so interrupted and so cut off that it was like, how do I still reach people? You know, like I got to do something. And so I started this podcast. But my fear with these podcasts, and you guys could not believe the number of podcasts I listen to throughout every week, just so that I could be better and better. But my fear is always that I'm going to ask the dumb question, or I'm going to ask like oh, I can't believe this question again. And one of the questions that I had was like, what is the question you're tired of answering when it comes to anything to do with LGBTQ issues or empowerment or advocacy?
Well, I mean, it's mostly, I think, follows what Kevin was saying about assumptions. So it's like, wait, are you married? Or wait, do you have kids?
Right.
Or
Right.
wait, you're not on PrEP? Like those things that I'm like, what? Like, I don't even like, why are you making the assumption that just because you have this weird stereotype in your mind from 1980s? so,
Right.
so like, I don't know what they're even thinking, but that's the question. Those are the questions that really like made me like, what? Like, what if I flip the coin and just ask him the same? Wait, are you sure? Are you married? Oh my God, are you still single? How's that possible?
Right.
You would break up, why? Or
Right.
like, dude, why are you drinking beer? I mean, it's just those things that are like so basic, like we're all human beings. So if everyone was so like uniformly equal, then we didn't have to deal so much with Tinder or trying to find someone who is like your mate, because everyone will be the same.
Yeah,
Okay?
no, you're so right.
Everyone is different. Even twins who were raised from the same family, one behaves one way, one the other, one is gay, one is straight. So like people have just to, have open minds when they're dealing with folks and understand that, their experience is so different from the others. So I think that's the only thing I'm tired of, is like making assumptions of that everyone's the same. We're so different, and you have to give everyone the benefit of the doubt and learn from them.
Yeah, I love that. As I was preparing for this, I was listening to different podcasts on, issues surrounding, may not even have been specifically people that were living as, in this community or being transgender. I was listening to some podcasts on transgender living. And one of the interviewers, I remember it kind of made me stop in my tracks. One of the interviewers said to a woman that she was interviewing, so do you remember like the time, I'm thinking she's going to ask, do you remember when you realized or when you decided to tell? She said, do you remember what made you gay? And I'm like listening, and I was just like, stop, rewind, what? And so like those are the types of questions that I would feel saying, what? Even a person who's interviewing, you would want to be so informed before you're in front of people, and ask the right questions. But those are things that I think fall into that stereotypical, what do I think about someone who's LGBTQ? And then what would satisfy my own uninformed questions, like what made you gay? But Kevin, like to the opposite, what do you wish people asked when interviewing and doing things like this?
Oh, that's a good question. I think that, I think that, I can only speak personally, right? Like my own personal experience. I think that, I've told Well, I'm really going there, so brace yourself.
Jump right in.
Oh my gosh, I'm gonna get into trouble at the end. So, so we do not have children, but it's been something that we've been thinking about and talking about for some time. And even when I tell some of my colleagues, I think that they have assumptions about how that necessarily happens. And I think that even just understanding, and this is kind of somewhat of a new frontier, but I think that there are also, it goes down to what Arturo was saying, like assumptions of how that happens. And, I think, asking, for me in my personal life, asking some of those questions, would change the conversation.
Yeah. So is it as clear as that? Is it as clear as saying, when you're considering family planning as gay men, what considerations do you make in terms of, is it adoption? Is it a surrogate? Is it like, how, or is it as clear and as easy as kind of breaking the barriers by asking it as plainly as that?
Yes, I think so.
Yeah, yeah.
So.
I love that.
Family planning.
I love that, because I do think that that also humanizes very human beings, in that, this is something that when you're in love, it's natural to be thinking about children. And, how does, I'm gonna expose my undying love for Arturo's little girl. I mean, I just love her. When I was walking around in Target today, and I see things, and I always say, I wonder if Arturo's going to think it's creepy if I just keep sending this all this stuff.
Never. We immediately put it on and then.
God, I know, and I love getting the pictures of her and everything. But Arturo, maybe like to Kevin's point, is it too personal to say, how does this beautiful little baby girl Natalia come to be in a relationship like yours?
Well, as Kevin was saying, is just, as natural as any human being can feel. The sense of having kids is one of them, and when you're in a relationship, you don't just have it to have each other. You want to grow the family, and yeah. Being a parent is, I can tell now, but from personal experience, is the most amazing experience of my life. I cannot be happier, and I think I will. Like, that's the best thing. I mean, until you have kids is when you actually realize what real love is, right? How much you love those kids. Of course, you love your spouse, you love your parents, but the love that you have for a kid is something else. It's like when people have pets, I think it's also some of that love, and they love them to death. This is like when you see that baby that is yours to grow and teach and make the best out of what you can with love. I think there's really nothing like that in this world. So it's an interesting process. You have to be very, very well informed, and you have to surround yourself from folks who actually have done it before, so you can learn. I mean, my best way to learn is from learning from other people's experiences, and hopefully not do the same mistakes or avoid some of them. That's the best way to learn. And there's a lot of people who have gone through the process of adoption of surrogacy. In our case, we did surrogacy, and it's not easy, but it's so rewarding once you have the experience of being a parent. So I think that's a point that I can bring empathy to other folks to understand us, because they see us as nurturing individuals who want to raise a kid in the best environment possible. So that can be a way for us to drive the conversation further, for them to understand LGBT community further. So,
and it's not unlike a man and a woman, husband and wife, who are experiencing infertility. It's not unlike that in that they're weighing those considerations similarly. I think the difference, and Kevin, I love that this was something that you brought up. I think the difference is when I can speak as a woman, when you're a woman who is the one who cannot have the baby for whatever reason, it becomes a very personal thing. It's like you don't want to have the conversation of how does that happen. And I do think that there could be those sensitivities where it's not that we don't want to know, it's that how do you ask?
Yeah.
And so I don't know how you feel about that, kind of hearing from the other side that it might not be as much of on, you know, the.
I get it. Actually, I think that's a great point. We have a dear friend who, you know, this has been an issue. It's a very sensitive topic,
Yes.
right? And extremely sensitive. And maybe it's different for the couple that you're communicating with about it. You know, maybe you may be more ready for it than some, you know, a different couple who's not ready to talk about it. But I will say, like, from our experience, just because it's been something that we've been talking about forever,
Yeah.
you know, I think that, you know, I do wish that I could have, you know, a little bit more of an open conversation of some of those struggles, right?
Yeah.
Some of those thoughts and considerations.
Yes. Well, I appreciate that too. And I love that I love the vulnerability and, you know, the fact that this is something that you're sharing that probably isn't unique to you, that it's, you know, something that, and like Arturo said, the best way to kind of learn and go through it is to find other people who have gone through it, because that's really kind of where you get the best insight as you go forward. I will say, undoubtedly, if you have a little one, I will be thinking of your little one as I'm walking through Target and be picking up things and going to.
The answer's always yes.
Yeah. Okay, I'm gonna end with, I usually end with a silly question, but I don't think that any part of this conversation that we've had has been silly. In fact, really, I want to thank both of you for participating with this with me. You know, I love both of you so much. We work together on so many incredible projects, and I consider you both like my brothers that I can pick up the phone and say, hey, I mean, Kevin, I have with my health issues, and Arturo, every time I get, you know, this midnight idea of what I want to do next in medical education, you're like the first person I call to say, what do you think of? So I thank you both for being, I don't know if that's why it's been so comfortable us having this conversation, but I thank you both for being with us. But I want to end with this question for each of you. And really, it's a question that I want you to consider the listeners, in that there may be someone listening that needs this answer. So, Arturo, I'm going to start with you. If you could give your younger self a piece of practical advice about navigating through life and through your profession in medicine, living out loud, being proud of who you are, now having this incredibly beautiful family and all your dreams coming true with your professional career, what would that advice be that would have saved any hardships you may have encountered growing up?
So much advice I can give myself, but I think one that I found very important is, you know, your family will always love you no matter what you do or make, because they know you as an individual, they know who you are, they know the value that you bring to all them, and the love that we all share with each other. So don't be afraid. If you had spoken earlier to them, they may have celebrated as much with you do, and you may not be as lonely. So you know that those who love you will love you unconditionally, no matter what. And if they don't, you'll learn to. You know whom to love further, and whom to pay more attention to. So that will have been my biggest piece of advice, is just to be open and to your family, and because they love you.
I love it. Thank you. Thank you, Arturo. And Kevin, same question.
I mean, I think my advice would be that it's going to be okay, right? Like, I think the idea of 20 years ago being on, you know, a Zoom chat and talking openly on social media about being married to a man, I don't think I would have really fathomed that I would be as public. And, it took a long time to kind of get to this point. And, even with myself from like 5 years ago, I think that it's important to be authentic and to just recognize that being who you are it's going to be okay.
Yeah. Well, I love it. I love the advice from both of you. I hope that the people who needed to hear that hear it and take it to heart, because it's true. I'm so proud of both of you and who you are in medical education and who you are as doctors that give life-saving treatments to patients that are meeting you at their most vulnerable time. I love you for who you are in my life and how much you've supported all of the things that I've done. And I look forward to a time where I can spoil everyone, the little girl we have, and maybe the little boy or little girl we may be having sooner, hopefully. And I really look forward to that time that we can be together again. And I thank you again for spending this time with us tonight.
Thank you.
Thank you. Good night, guys.
Okay. Good night.